In this lecture, we are going to talk about the anaphylactic shock and histamine shock. The anaphylactic shock basically is also a type 1 or immediate hypersensitivity response, and this type of shock basically develops in people who are allergic or who are sensitive to some kind of antigens. Now, the type of antigens which may ultimately lead to this kind of shock, the anaphylaxis or the anaphylactic shock, that antigen may be a normal environment substance, or maybe a food particle. For example, it may be a particle in the peanuts or almonds or walnuts, or it may be a pollen. Now, these substances will not normally cause allergy in normal people, but some of the people are sensitive, and in those people, if this antigen is introduced into their body, it basically interacts with the B and T cells. Now, the B and T cells are responsible for immunity, or basically they are all the time ready to fight any foreign invader like bacteria or viruses, and they basically produce, the B cells basically produce the antibodies, and the T cells fight themselves and they kill the germs or the bacteria, the viruses, or any foreign component. Now, this environmental substance, this part of the peanut or this pollen, this is not a foreign body normally, but in these people who are basically having the anaphylaxis, or who are basically having the sensitivity to these substances, in these people, their B and T cells, which are basically the immune cells, we are not going into the details of the B and T cells, but just understand that these are component of the immunity which fight infections or foreign substances. Now, in these people, in these normal components of the food, they are basically identified as foreign particles or some invader. Now, they basically starts interacting with these foreign invaders, and especially the B cell starts interacting with them, and the B cells produces antibodies against these specific antigens, which may be a food particle, or which may be a pollen, or which may be any environmental substance to which that patient is basically sensitive or allergic. Now, once this antigen is introduced into the body, it will interact with the B cells. The B cells will produce antibodies against this antigen, and those antibodies, they will basically bind to the mast cells. Now, they will bind to the mast cells and to the basophils. The mast cells are basically present in the tissues, and the basophils are in the blood. Now, this is the first exposure, and next time this antigen enters the body, it will directly bind to the antibody. It will directly bind to the antibody, or the antibody will directly bind to this antigen, and they will try to stop the invasion of this so-called invader or foreign particle. And while doing so, when it binds to the antibodies which are now attached to this mast cell, these mast cells, they get activated. Now, once the mast cells get activated, they releases histamines and tryptases. Now, the histamines and tryptases released by the mast cells in the tissues and the basophils in the blood, this histamine and tryptase, they have some actions on the blood vessels, which is responsible for the ultimate presentation of the anaphylactic shock. Now, it has the histamine and the tryptase has a lot of presentation. They have a lot of actions, and there are a lot of allergies in which the histamine and the tryptases are involved. But as we are basically discussing the circulatory shock, and anaphylactic shock is one kind of shock, so we will basically try to focus on shock component. Now, once the histamines have been released from the mast cells, what they do is they act on the blood vessels. They act on the blood vessels. They basically dilate the blood vessels. Now, suppose for example, if this is a normal blood vessels, this blood vessel will dilate. Its diameter will increase this much, from this much to this much large. Now, these blood vessels, they will dilate. When they dilate, blood will start pooling in these blood vessels. In these vessels. So when the arterioles dilate, they will decrease the arterial pressure. When the veins dilate, they will decrease the venous return. So the return of the blood back to the heart will decrease. On top of that, they will also dilate the capillaries. They will increase the permeability of the capillaries as well. When they increase the permeability of the capillaries, now heart is basically pumping the blood, and blood is coming through the aorta into the arteries, into the arterioles, and here the capillaries, and from the capillaries into the venules and veins, and through the vena cava, it comes again to the heart. Now, at the level of the capillary, the permeability of the capillaries is increased, so the fluid starts coming out of the capillary. Now, the diameter of the blood vessels has been increased, which has led to pooling of blood, and the blood has been pooled in these vessels, due to which the venous return has decreased, because less amount of blood is available for the heart to pump. And on top of that, there is permeability, due to which fluid is lost into the tissue. Now, all these factors, when combined, decreased venous return, decreased arterial pressure, and increased capillary permeability, they all lead to decreased availability of the volume of blood for circulation. So the arterial pressure falls and a condition of shock develops in which proper amount of nutrients cannot be supplied to the tissue. And this type of shock, due to the release of histamines and due to action of histamine on the blood vessels, is the anaphylactic shock. This is anaphylactic shock, and it occurs in those people who are basically sensitive to some substances. And this type of sensitivity is type 1 hypersensitivity, which is the immediate type of hypersensitivity. Now there is type 2, type 3, type 4 hypersensitivities as well, but we are not going to discuss because our focus is on shock, and here we are basically focusing on the effects of anaphylactic shock, not on other effects. Now some patients, when there is release of histamines due to introduction of some antigen, they may get different kinds of symptoms apart from shock. They may get urticaria, they may get angioedema, in which the swelling of lips may occur, or oral mucosa may occur. They may get wheezing, hypotension, their BP will decrease, and they may get shortness of breath, as in asthma. And the investigations done to diagnose these patients who are basically sensitive or who are having type 1 hypersensitivity reactions, the investigations used are basically skin prick test, the level of IgE. These are IgE antibodies basically. These are IgE antibodies which are involved in these reactions. Not all antibodies are involved. So the level of IgE is measured, and supervised exposure. In some patients, a small component of the antigen is introduced in them, and then they are seen for these symptoms. The urticaria, in which there is itching of the skin and some swelling, and then angioedema, in which the oral mucosa swelling occurs, wheezing, in which asthma-like features will occur, and decrease in blood pressure and shortness of breath. So supervised exposure is also a diagnostic investigation. Then the treatment, depending upon cause, is adrenaline, especially in anaphylactic shock. Anaphylactic shock is specially treated with emergency administration of adrenaline. Then anti-allergics and glucocorticoids may also be helpful. But our focus is not on type 1 hypersensitivity or anaphylactic reactions in general, in which all these symptoms may present. Our goal is basically to understand the anaphylactic shock, and to summarize it, anaphylactic shock occurs in those patients who are basically sensitive to some antigen. When that antigen is first time introduced, the B cell will react with them and will produce antibodies, which will be IgE antibodies. Those antibodies will then bind to the mast cells, and next time when that antigen is introduced into the body, the mast they will react with it, the antibodies will react with the antigen, and the mast cell will basically get activated and release histamine and tryptases. The histamine and the tryptases will basically dilate the arterioles, which will decrease the arterial pressure. They will dilate the veins, which will decrease the venous return, and they will increase the capillary permeability, which will lead to loss of fluid. All those factors will basically decreases the arterial pressure. They will decrease the perfusion of the tissue, and a condition of shock will develop, which will be known as anaphylactic shock. Now, the difference between anaphylactic shock and the histamine shock is that anaphylactic shock basically occurs due to introduction of the antigen into the body, while histamine shock occurs when histamine is introduced directly into the body. There is no introduction of the antigen, or direct histamine is injected into the body, and all the features of anaphylactic shock will develop, and this type of condition is known as histamine shock. So that's all about the anaphylactic shock, in which a lot of sign symptoms can occur. And apart from these investigations of skin prick, IgE level, supervised exposure, there are a lot of other investigations. It is a very, very big topic, and there are a lot of people who are having these types of allergies, and a lot of deaths occurs due to anaphylactic shock. So it is very important, but we cannot cover it. We are just superficially discussing the anaphylactic shock. So that's all about the anaphylactic shock. Thanks a lot for watching the video.